1, I'll be performing a physical exam on you. Is that okay?
Okay.
I've already washed my hands and donned gloves for the purpose of this video, and I would have already done vital signs of the patients. Are you in any pain?
No.
Okay, so I'll begin by inspecting the patient's skull. I'm going to ask you to tilt your head forward. So the patient's head is round, normocephalic, atraumatic. His head is midline and symmetric. I'm looking at the side of the patient head. I'm also looking at the back of the patient's head, and I'm not seeing any bumps or lumps, no masses on the patient's head. The patient's hair appears thin on the sides, as well as the patient's hair color is black, and the hair is evenly distributed with some signs of pattern balding in the frontal area. The patient has normal facial hair. I'm going to palpate the patient's head. Let me know if you're feeling any tenderness. Are you feeling any tenderness?
No.
The patient's face is symmetric. His skin is intact. There's no rash, no lesions on the face, no acne, no discoloration, no facial abnormalities, no facial deformities that I can see. I'm looking at the patient's eyes. I can see that they're evenly distributed. There's no lesions, no discharge coming from the eyes. The eyes are centered and they're equally colored. The pupils, I'm going to pull down on your eyes a little bit. There's no yellowing of the eyes. Pupils are midline and equally sized. The patient's eyelashes and eyebrows are evenly distributed. No swelling, no lesions on the lids, no discharge. While looking at the patient's eyes, the conjunctiva and the sclera is clear, white, and moist. The iris is round. It's evenly colored. It's equal in size and centered bilaterally. The cornea itself is clear and transparent. Looking at the eyes, I can also see that the medial and the lateral cantuses of the eyes are without encrusting. Looking at the nose is midline. There's no drainage coming from the nose. It's proportionate to the face. The ears are equal in size, bilateral on the head. No drainage coming from the ear. Looking at the ear, I can see also that they're aligned with the outer canthus of the eye. I'm looking at the lips. The lips are smooth. There's no cracking of the lips. There's no lesions on the lips. And I'm looking at the patient's trachea, and there is no tracheal deviation. I'm gonna also palpate the sinuses for tenderness. Let me know if you're feeling any areas of tenderness. So I'm palpating the frontal sinuses. Is there any tenderness? I'm palpating the maxillary sinuses. Is there any tenderness?
No.
Okay, so I'll also palpate the temporal artery. I'm gonna place my fingers by the tragus of the ear. Bilaterally, the pulsation is about 2+, which is regular, and it is without any tenderness. I'm also gonna palpate the patient's mastoid process, where you're gonna let me know if you're feeling any tenderness as well. Is there any tenderness?
No.
I'm gonna have a look at the patient's lymph node. Let me know if you are feeling any tenderness. I'm gonna start by palpating the patient's preauricular area. Are you feeling any tenderness?
No.
I'm gonna palpate the postauricular area. Any tenderness?
No.
Septal area.
No.
Submandibular, the submental. Let me know if you're feeling tenderness.
No, okay.
The superficial cervical area, the post-cervicular area, and the supraclavicular area. Are you feeling any tenderness at all? So there's no enlargement or tenderness of the lymph node that I can feel. I'm going to ask you to tilt your head back a little bit. I'm going to observe the thyroid, where it is, by asking you to swallow. Okay, and as the patient swallow, I'm able to feel the thyroid without any mass, no nodules, no lymph node enlargement. I'll now test for visual acuity of the patient and in cranial nerve number 2, and I'm going to test using the Snellen chart. And I'm going to ask you to read the lowest line that you can read as I hold it here.
LTFPN.
I'm going to ask you to cover your left eye and read the lowest line that you can read.
LTLPH.
Okay, I'll cover the other eye and read the lowest line.
LTFPH.
Okay, patient is able to read on the Snellen chart at 20/20 vision. So I will now be testing the patient for visual field. I'm going to ask the patient to focus on my nose, cover your right eye, and I'll cover my left eye, and you tell me if you can see my fingers from where they are.
No.
Okay, so now you're going to tell me when you see my fingers, okay? You able to see my fingers now?
Yes.
Okay, I'm going to do the same thing on the other side, and you're going to tell me, are you able to see them now?
Yeah.
Okay, very good. We're going to switch eyes, and you're going to cover the other eye, and we're going to do the same. Tell me when you see my fingers.
Yeah.
Okay, very good. And we're going to try again, and you're going to tell me when you see my fingers. Can you see my fingers? But tell me when you're able to see my fingers.
Yes.
Okay, very good. That is the test for visual fields. Now I'm going to be checking for convergence, and I'm going to ask you to focus on the pen. And as I do that, I'm testing for convergence. I'm going to ask you to not move your head, but you're going to use your eyes to follow the pen, okay? So as I go, use your eyes to follow the pen, not your head. Okay, very good. Very good. Very good. Very good. Very good. Eyes and not your head. Very good. So this is me testing the patient's cranial nerves, the oculomotor, the trochlear, and the abducens cranial nerves. And his cranial nerves are intact, no nystagmus or strabismus. I'm going to ask you to look at a picture on the wall behind me. Looking at a picture on the wall behind me, then I'm going to ask you now to look at the pen.
Yeah.
Very good. Convergence is normal. His eyes dilate and contract. Raise your eyebrows. Very good. I'm going to ask you to close your eyelids tightly. And now I'm going to ask you to try to see if you can raise your eyebrows with it. Show me your teeth. Very good. Now I'm going to ask you to smile without teeth. Puff out your cheeks. The facial nerve is intact. All right, I'm going to move on to pupillar response. I'm going to be using my pen light. Shine the light in your eye. And I'm going to ask you to look off in the distance. So, okay, very good. And I'm going to do this on the other side. Very good. I'm going to do it again as I look in the opposite eye. Okay, and I'm going to do the other side. Okay, very good. Pupils are equally and bilaterally reactive to light, both directly and consensually. Also, to look at the structures of the patient's eyes. So I'm just turning the light on and assessing, and then I'm going to look at the patient's left eye. So I'm going to first find the red reflex. I'm going to move in to see the internal structures of the patient's eye. Very good. I'm going to do the same on the other side. Using my right eye, looking into the patient's right eye. I'm going to find that red reflex, and I'm going to move in when I locate that red reflex. And the optic disc margins are visible. There's no blurring of the margins, and I can also visualize the optic vessels. I will begin with the Weber's test, and I'll be using a 512 tuning fork for that purpose. You're going to tell me where do you hear it, okay? Where do you hear the sound?
In front.
Okay, that's normal because it's heard midline. I'll also be testing the Rhine's test on the patient. So I'm going to place the tuning fork on the mastoid person. You're going to let me know when you no longer hear the sound, okay? No longer hear it. It's gone? Okay, and I'm going to be doing the same. You know when you no longer hear the sound.
It's gone.
Okay, the patient's hearing is normal without any sensory, neural, or conductive hearing loss. So I will do the whisper test, and which is testing for auditory acuity. You're going to let me know what word you hear I say.
Hallelujah.
Okay, and I'm going to do it on the opposite side, and you let me know what word you hear me say.
Preparation.
Okay, the patient is able to repeat what is heard. I will now examine the internal structures of the ear. And that one again, making sure that my light is working. So it's an adult male, so I'm going to pull the auricle up and back, and I am looking for the patient's tympanic membrane. I'm going to do it on the opposite side as well. Ear up and back. Good. So I can see that the auditory canal is pink and smooth. There's no obstructions, which means the auditory canal is patent. The tympanic membrane is pearly gray and it's intact. So there's no perforation or scarring to the tympanic membrane. I can see the cone of light at 5 o'clock in the patient's right ear and 7 o'clock in the patient's left ear. I'm going to ask you to close one nostril and breathe in. And I'm going to ask you to do that on the opposite side. Close the nostril and breathe in. Okay. And I'm going to ask you to tilt your head back as I hold the nose. Very good. I can see that the patient's nears bilaterally is patent. It is pink, moist, and there's no polyps in the patient's nasal area, and the nasal septum is straight. And I'll look at the patient's mouth, detecting the gums. So as I use the tongue depressor, I'm going to be moving around. I'm going to ask you to stick your tongue out a little bit. I can see that the patient's teeth is white, and the dentition is intact, and there's no signs of decay or loose tooth in the patient's mouth. The gum and mucosa is pink and it's moist, and there was no signs of bleeding in the patient's mouth. I'm going to ask you to open again to say ah.
Ah.
Okay, so the uvula is midline. The patient does have normal rise and fall, as well as I can see that the tonsil is symmetric. So that's test of cranium nerve number 9, glossopharyngeal, the hypoglossal, and the vagus nerves, which are intact. I'm now going to test the patient. Use a Q-tip, which I have the sharp side, which I'm going to remove the cotton from, and a dull side. So I'm going to let you feel. So this is what sharp feels like, and this is what dull feels like. So I'm going to ask you to close your eyes, and as I test, you let me know what your if it's sharp or dull. Okay? So
Dull.
this one.
Sharp.
Okay, and this one.
Sharp.
About this.
Sharp.
Okay, very good. And the patient says he's feeling sharp, and I am using the sharp side. I'm going to test again. What are you feeling?
Soft.
Dull, sharp, or dull?
Dull.
Very good.
Dull. Dull.
This cranial nerve 5 is intact. So I'm going to put my arms on your face, and I'm going to ask you to turn from side to side against resistance. Very good. And I'm doing the same thing on the other side. Okay, I'm going to ask you to shrug your shoulders upwards against resistance. Very good. And this is me testing cranial nerve number 11, which is intact. The patient has full range of motion in his neck, no stiffness, and the strength is a 5 out of 5. I'm now going to do lung assessment on the patient. I'm going to first inspect oral mucosa just to look if there's any cyanosis, looking around the patient's mouth, and also looking at the eyes. I'm going to look at your fingers as well, and I'm looking for any cyanosis, and there's no signs of cyanosis. Capillary refill is less than 3. I'm looking at the patient, and his breathing effort is normal. I'm going to ask the patient to open his shirt a little bit so I can see his bare chest, so I can see that the patient has normal breathing effort. I would normally do check the respiratory rate, rise and fall of breath for a full minute. The clavicular areas are symmetric. The patient is breathing without any distress, regular rhythm and rate as I can visualize. There's no nasal flaring, there's no pursed lip breathing by the patient. I can see that the skin on the chest, anterior chest, is intact. There's no lesions, there's no masses. The nipple lines are symmetric. As the patient is breathing normally, I can see that chest movement is symmetric on both sides bilaterally. There's no intercostal retractions, there's no deviations or use of accessory muscles, as I can see that the anterior posterior diameter of the patient is normal within. Looking at the posterior spine, I can see that the patient's spine is midline. Looking at the patient's back as well, I can see that the shoulder blades are also symmetrical. There's no sign of lesions, bumps, or anything. There's no curvature of the spine. There's no indentations on the spine as well, and no protrusions. I'm going to palpate. Let me know if there's any tenderness as I palpate. In the chest area, I haven't feel any mass, no tenderness. The patient is not having any pain as I palpate the chest wall. There's no signs of crepitus. And I'm also going to palpate the posterior chest wall, not feeling any fremitus or anything. I'm going to ask you to take a deep breath in and out. And as the patient inhale and exhale, I can see that there was symmetrical expansion of the chest, and there was no costovertebral tenderness. First, I'll be auscultating anteriorly. Deep breath in and deep breath out. Okay, go ahead. Very good. On the other side. Good. Very good. In. Again. And out. Breathe in and out. Okay, breathe in and out. Breathe in and out. Very good. And I'm going to do the same on the posterior side. I'm going to ask you to breathe in and out as I. And breathe in and out. Very good. In and out. Breathe in and out. Breathe in and out. Breathe in, out, in, out. Very good. In, out, in, out. And I'm also going to be listening to breath sounds on the lateral side. Breathe in and out. Breathe in and out. Very good. So I can hear vesicular sounds over all the long fields. The end of our video. Thank you.